Are you ready?
I'm not sure. I know that you have a really tough topic today, and that's hotspots. You're going to make me work hard.
We had some lovely questions from the community, and I think hotspots would be a great one to tackle. So I'm excited.
I'm not sure whether I see anything lovely on hotspots. They're really annoying and a pain in the butt, and many dogs suffer from them. And that's why we are here today to tell everyone how to treat them and how to prevent them without drugs.
Yes.
I'm super passionate about hotspots because they're so misunderstood, because so many people actually think that they're just an infection or a result of dogs swimming and exercising in spring or having allergies, but they're much more complicated than that, or simpler than that, in fact, because the hotspot itself is just a signal that something more serious is going on in the body.
And so for people that have never seen a hotspot, or they're curious if they have a hotspot currently on their dog, what do they look like?
The term hotspot is actually a popular term. The medical term is surface pyoderma. Surface, obviously, surface of the skin, and pyoderma stands for infection, pus infection of the top layer of the skin. So dermis is skin, and purulent, that's for the pus and infection. So for those of you who have not seen hotspots, they are basically hairless patches of skin, inflamed, oozy, red, itchy, sometimes smelly, sometimes crusty. All those are hotspots in different versions. And it really depends on the dog's constitution and also skin type, what they look like. But the common nature is that they're basically itchy, sore, hot, red, inflamed, and hairless most of the time. Or the hair is really stuck to the surface and starts kind of sloughing off because of the infection. And obviously there is a component of bacteria that is growing on the surface of the skin. But the bacteria is more of an opportunist, because if you look at the hotspot kind of like in its substance or essence, hotspot is actually only a signal that something more serious is going on in the body, whether it's spinal inflammation, muscle inflammation, skin propensity to these hotspots because there's some sort of weakening or lower blood flow. All those actually play a role in the hotspot formation, let's say.
And can they show up anywhere in the body, or on the skin, I should say?
They can show up anywhere in the body. However, they show up commonly in certain areas. You can see them on the head, you can see them on the chest, on the torso. I see them around the tail quite often, on the thighs, and pretty much anywhere where there is a decreased energy flow to the body. That's super important to mention because, in veterinary medicine, we have learned to separate and somehow isolate certain problems. So when we see a hotspot, we would start treating that area. We don't ask, does it happen because of some sort of other underlying reason? Often we don't ask that in medicine, in conventional medicine. In the early days of practice, I saw that when I treated a hotspot, they may have gotten better, and then they came back. And I would see the same dogs coming back with hotspots. So eventually, I really started to look at what is going on and trying to determine whether the hotspot is actually the only problem or whether there are some other issues. Eventually, I started to notice that there are two things. If a dog chews at a certain area, it may actually result in a hotspot because they traumatize the skin. But the chewing and scratching itself should not cause healthy skin to create a hotspot.
Right.
So there was another problem. There was weakening of the skin in that segment. So when I started looking a little closer, I saw many of these dogs having either some sort of muscular discomfort or inflammation under the skin, or they would have spinal issue that would relate to that particular segment. So I'll give you an example, and I'll use myself as a dog because I don't have Pax around me somewhere outside. Actually, he's watching the world going by on the deck here. If you, let's say, have a hotspot on the forearm, you have to trace the nerves and the energy line back to the spine. And you basically discover that a dog has inflammation or injury of that particular segment. So in this case, neck. Think of a collar that pushes on the neck, injures the nerves, and reduces blood flow to that particular area, nerve flow to that area. Then hotspots are more likely to actually happen in that area. Or dogs will start chewing because they have a normal sensation in their feet or in their arm because the nerves have been damaged or injured, or the spine is misaligned, or there is muscle tension. We all know that. If we have sore back, we may have tingling or pin and needle sensation and all those kind of abnormal symptoms.
Yeah.
So again, I started to see that that certain spinal segment relates to the area where the hotspot is. So instead of treating the particular local area, even though I would treat it, and I will get to it, how hotspots could be addressed or should be addressed. But I also would start looking at, let's say, removing the collar, or doing acupuncture, or sending a dog to a chiropractor or physical therapist to address the issues that are in the spine. Now, if you look at hotspots in the hind end, they may result from inflammation, injury of the lumbar area, or they may also result from sprain or muscle tension or some sort of weakness in that particular thigh. If you have a dog that licks their abdomen, again, that could stem from spinal segment that is misaligned, sore, inflamed, and the abnormal sensation will actually be, and the energy kind of depletion can be actually manifesting on the abdomen, itching, abnormal sensation, or just weakening of the skin because the skin doesn't get enough blood flow and nerve flow. So see hotspot as a result of several different potential issues. I'm not denying that sometimes it can be just primary skin issue. I'm not denying that sometimes it can be allergies. But often it is a result of some sort of musculoskeletal issue that has not been addressed. And people say, well, but it usually starts happening in the spring, and it must be allergies. Well, what happens in the spring? Dogs start being active after actually sitting or lying on the couch for the whole winter, and then they're weak and they start injuring themselves and start seeing and feeling all these different inflammatory spots, and they start chewing. Obviously, there are some other issues. Nutritional abnormalities or deficiencies, lack of omega-3s, mineral deficiencies, vitamin deficiencies, they all can be part of the problem. Also, toxins and toxin buildup can be a problem. The body and the skin gets weakened. See hotspot as a signal from the body that there can be many things wrong. And what you need to do is to apply what I call the healing cycle. When you go through basically addressing each individual potential cause. So the first one would be, let's look at the hotspot and actually treat it locally and topically. But what usually happens in conventional medicine, steroids and antibiotics are used, and sometimes really harsh and toxic cleaning solutions like chlorexidine. I have come up with a treatment plan that doesn't really need to include antibiotics, steroids, or the harsh chemicals. And this is something that, again, took me some time. And I eventually resourced from what my grandfather taught me about herbs and formulated skin spray or healing solution. At any time I have hotspots, or anytime I have any skin problems, skin wound, abrasion, bee sting, insect bite, whatever it is, I use skin spray. What you need to do is first shave all the hair around that area, because if you don't shave it, it can harbor moisture, and the bacteria that became very opportunistic may actually continue kind of eroding and eating away on the surface of the skin. Make the perimeter hair free so the bacteria doesn't spread. And then I would just use either I would use regular just water or gentle soap, and I would just clean it with gentle soap or water. Then after you wash it and you wash all the scabs away, then you dry it really well with sterile gauze. And again, you don't need to worry too much about having exactly everything sterile, because there's already a lot of bacteria in there, right? So if you take a shower hose and just shower that area and wash the area nicely and make it clean, that's all you need to do, really. And if you want to use a little bit of soap because it kind of dissolves the scabs if there are any, that's another way to go. There are very rare instances where the infection gets deeper when you need to use antibiotics, but most of the time you don't have to. So after that, after you wash it and dry it, you apply the skin spray and apply it 4, 5, 6 times a day, just basically as much as you want. The other thing that you can do is to put a bandage on it and saturate the bandage with skin spray and repeat that saturation again 2, 3 times, 4 times a day to keep it warm. I used to joke, and I have a video where I just say, saturate, baby, saturate. So you have to saturate with, with skin spray. And, usually it heals quite well. But there's another thing that you need to do. You need to address the underlying causes. And before we go there, I'd like to talk a little bit about antibiotics and steroids and what happens. So number one, when we use antibiotics as a treatment, it will give you the impression that everything is fine, but it's definitely not addressing anything else than the local area. Second, the skin has a very important microbiome, and if we start using topical antibiotics without needing to use them, then we actually do disturb the microbiome of the whole skin and the area. Second, usually the hotspot medication is also steroids. And steroids, I don't really know why we use them so much, because they not only absorb and affect the adrenal glands and the rest of the body, they also suppress the body's immune defenses. So at times when we have an infection, it doesn't really make sense to use something that suppresses the immune system. It reduces the inflammation and it reduces the itching, which is obviously very soothing. But so is the skin spray with all the different ingredients like yucca and witch hazel and calendula and hydrostus. So we've been able to address it without the side effects of steroids. I basically almost never use steroids. The only exception is when I have Addison's disease, a dog with Addison's disease where the adrenal glands don't produce enough steroids, then you have to use them. But otherwise, I think that there is almost no indication in veterinary medicine where we really have to use steroids and there's nothing else that you could use. And I know that some people may be surprised over that statement, but in 30 plus years of veterinary medicine, I confidently say that I almost never need to use steroids.
Which is amazing. And that's how it should be.
Ideally, right? I think we use steroids as a quick fix. We use steroids to give people the illusion that everything is fine, but we are really not fixing anything. And this is the biggest challenge in medicine. If we learn how to prevent problems, number one, and if we learn how to treat them without these harsh drugs, I think that we'd be better off. Because what happens with the use of antibiotics and steroids, very often the problems come back, and that's the biggest challenge, that the issues come back because they're not really resolved.
Definitely.
The only other thing that I would like to mention about the conventional treatment is the use of Hibitane or Chlorexidine, the antibacterial soap that is really commonly used. I had one situation long time ago when a client had a dog going through surgery, and when they left the clinic, we gave them Chlorexidine and asked them to clean the incision. And 2 weeks later, the dog came back for suture removal. And I remember that as if it was today, I would remove the stitches and the wound just basically opened up completely. And I was shocked. So I inquired what the client did, and she said, well, I put the soap on. And she put the undiluted Chlorexidine on. Basically, it prevented the cellular healing. And it dawned on me that when you use these soaps, Chlorexidine soaps, they're toxic to bacteria. Hence, they're also toxic to the cells that are supposed to heal. But if we dilute it, the toxicity is not as high, right? But if you really use it unconcentrated, then it's really toxic and it prevented the healing completely. When you look at the label of Chlorexidine and when you start doing some digging around, you realize that it is really a toxic substance and that I would prefer not using it if I don't have to. Yep. Obviously, sometimes we do need to use these soaps, but again, very rarely. And, the only thing I can think of is of surgical scrubs when you really need to have a quick effect. You scrub the skin and then you basically wipe it off and wash it off because you don't want the Chlorexidine to stay on around the incision and so on. So that's the only part.
I would love to go back to the what if. So if I have seen a hotspot and now I'm going to a chiropractor, everything's going well, but we're still seeing something. What is there in the healing cycle that I should start doing?
A really good question. So let's say that that you see hotspot and you're aware enough that you know that you have to check the local area for any sprain or muscle abnormality. Mm-hmm. Why the dog is chewing, because dogs don't always chew because they're itchy. They sometimes chew because they're sore. They sometimes scratch because they're sore. They have tightness, but people don't realize that. So that's one thing. If you go and have the spine examined, you go to a chiropractor or you go to a physical therapist, acupuncturist, someone who actually addresses the energy flow and the spinal alignment and the muscles, and things don't get better, then number one, I would always recommend doing blood work and see what's going on the level of complete blood cell count and chemistry of the organs. There can be an organ dysfunction, or there can be some sort of, abnormality in the blood count. Those are really important parts. Second, every dog that has propensity to hotspots should go through testing for hypothyroidism. It's very common because dogs, not only they're predisposed to hypothyroidism, they also pull. If they have a collar, they pull, they traumatize the thyroid gland, and they may end up hypothyroid. Sometimes adrenal glands can play a role. Obviously, dietary issues. The skin is an expression of what our diet is. I always compare our body to a tomato plant in the garden. And you recognize when the tomato plant is deficient of something or that is not healthy. And we are not expecting tomatoes grow in really poor soil, healthy and good and strong. But we give our dogs processed food often, or people, with the best intentions. Maybe they're busy, maybe they can't afford better food or something like that. But then when this happens, when we feed our dogs kibble, often the kibble is not complete. It sits on the shelf for 6 to 12 months or maybe longer. And then we feed it and we expect our dogs to be healthy. So that's a big challenge. Mm-hmm. I often have people saying, well, but I'm afraid that if I don't feed kibble, that the diet is not going to be complete. But we've solved that many, many years back. Unfortunately, when you look at the label, and the label has, starchy surrendered ingredients and wood chips and all that. Like, how can that be complete? The other thing is that the analysis is done by, analyzing the food by burning it and heating it really highly. It's not all that the dog can digest. So we're kind of measuring something that the dog doesn't even have access to from the kibble. So it's just like, it's all wrong. And in the last 25 to 30 years, I started feeding raw food. I undeniably saw such a difference in how healthy dogs are. It's just, do we really still need to have the discussion? So going back to hotspots and nutrition, if you have a dog on kibble and you see hotspots, super important to start giving them wholesome food. If you can't feed species appropriate food, you are compromising your dog's system more likely than if you feed raw food or cooked food. And again, raw food, supplements, you can make it beautifully complete and much more valuable, nutritionally complete than if you feed kibble. I want to touch one more kind of aspect of this. So many brands say, there is glucosamine there, there's, omegas in there, like there is probiotics in the food. Probiotics in the bag of food, they don't survive. There's probably not enough of them. When it comes to omegas, like if I open a bottle of omegas, they go rancid within weeks, and these sit in the bag for months, right? Like it's all rancid, and obviously not enough because the price would go up by $30, $40 if you put enough of the omegas.
At least, yeah.
It's like there's so many issues that I don't want to really spend huge amount of time by just diving into diet because there are other topics and other recordings that we can do. But I'm still surprised that we need to talk about this. Like every sane person that looks at the kibble label will see that most of them are not really aligned with what dogs should eat in nature or what dogs would eat normally. And the rest, again, processed heated ingredients, even if they have the best possible ingredients in them, they still are not fresh enough for my liking or for my level of what I would give to my dog. And when it comes to cost, if you can't afford to feed a large dog because food is expensive, and I understand that, maybe next time you may want to consider a smaller dog that eats less. I often see people with good intentions, like doing research and spending a lot of money on kibble because, I don't know, because that's what people do. And I try to find a lot of empathy, but if I'm compassionate, I can't really tell people, oh, it's fine, please them. It's not fine, and it's never going to be fine. And unfortunately, it's just the fact. I got lost a little bit in the dietary segment here. The next one, beside diagnostics and chiro and spinal alignment and food, is toxins. Toxicity can be a real issue in the 21st century. We don't even know how many toxins we are exposed to. So the liver is a huge organ. It has a very important role in detoxing the body and processing toxins and eliminating them from the body in bile or by neutralizing them biochemical processes. And once every 3 to 6 months, I do a liver cleanse. I do liver cleanse for my dog Pax. I do liver cleanse for myself. I'm actually on one right now. And I recommend this kind of protocol for every dog. I've seen several different changes when I use liver tune. Let's say if I eat food that is not optimal. Just recently, it was my birthday, and there were cakes and goodies and so on. I started cleanse right after my birthday, and I noticed that I am much less puffy in the morning, and my skin is clearer. I just feel better as well. I sleep better and so on. So the only thing I can say, if people want to see the difference, they can try it, or they can try it on their dog. We have a product for people and also product for dogs.
Definitely.
I also noticed that when you use liver tune in dogs with hotspots or even ear irritation or inflammation, that the inflammation goes down. And I've had a few clients telling me, my dog has had chronic ear problems, and whenever I give liver tune, the inflammation goes down. So now I don't need to give the meds and the antibiotics and all that stuff. So those are the reports that I get. Liver tune is a little bit of a surprise in my product lineup because whenever I formulate a product, I believe that it should make a difference, and it's based on my experience and knowledge of the herbs and research and so on. But every product surprises me a little bit because I did not expect that it would have such a positive effect on calming down the immune system and just kind of like reducing the inflammation. And that's something that really surprised me.
And is there anything you would like people to know if they're dealing with hotspots right now? Last remarks.
Wow, that's a really loaded question because I want to be politically correct. I don't want to offend anyone. And at the same time, I'm thinking, if you have a simple hotspot, maybe try to treat it at home, unless you have a really super open-minded veterinarian who will not use antibiotics and steroids and toxic chemical solutions. Now, I just want to say that most veterinarians are very caring, but they may not have been taught about how hotspots could be treated without drugs and chemicals. Hence, be kind, be polite, but communicate with your veterinarian if you do go and see a veterinarian for hotspot treatment. And definitely, even if your vet says, it doesn't have any connection with the muscles and the spine and the other issues, please, please, please have your dogs checked by chiropractor, physical therapist, acupuncturist to make sure that you don't ignore those. And obviously, your veterinarian will help you guide you through testing and making sure there is no systemic disease or organ issue and so on. So it should be collaboration. And I trust that your vet is open to collaborating with other practitioners. Let's communicate, let's be open-minded, and let's share this information with as many people as possible. It makes me super happy when I see that people, after years, coming back and talking to me about their dogs. Let's say I meet them on the walk or at the beach, and they tell me how much they learned and how much other friends of theirs learned about treating hotspots or some other issues. So it makes me really happy. So, the final message is keep learning, keep your mind open, and don't always accept status quo if we feel that there's something wrong with it. That's all.